To understand blood circulation, it is important to understand three things. That we have blood flow, because without blood flow, our body won't get the necessary oxygen and nutrient it needs. And if it does not get the required oxygen and nutrient, it will cause heart failure eventually, right? And then we have a blood pressure. So, you cannot have blood pressure that is too high. You cannot have a blood pressure that is too low. Okay? And then we have perfusion of blood. Perfusion basically means the flow of blood through the tissues where actual exchange of nutrients occurs from the blood vessels, specifically the capillaries, into the cells and the extracellular fluid, right? But the actual definition of perfusion is the flow of blood per given volume or mass of tissue in a given time. So perfusion basically means how much blood is flowing through a mass of tissue at any given time. So it's important to understand three definitions before you go ahead. Okay, first one is blood flow. Okay, what is blood flow? Blood flow is the flow of blood through an organ and tissue, and it is measured in terms of ml per minute or liters per minute if you're looking at liters. Okay. Now we have calculated the cardiac output in the past. The cardiac output is about 5,000 liters per minute on an average, right? So blood flow literally talks about movement of blood, okay? And it is literally the same as cardiac output, okay, in ml per minute. Okay, this one isn't later, but you can convert it to ml, okay? All right. So let's revise cardiac output really quickly. Cardiac output is also measured in ml per minute, and cardiac output is equal to stroke volume, that is in ml per beat, times heart rate, which is in beats per minute. Okay, so what is cardiac output? Cardiac output basically tells us how much blood the heart is pumping, right? So at rest, the total flow of the blood is equal to the cardiac output, which is about 5.25 liters per minute, or about 5,000 milliliters per minute. Okay. The cardiac output is equal to the stroke volume times the heart rate. Now, stroke volume, if you remember, is the volume of blood ejected from each ventricle when the heart contracts. Okay, and this is the formula for cardiac output, and you need to remember this. There's no way around it. And then we have blood pressure. Everybody knows we can measure blood pressure, right? And we're actually measuring arterial blood pressure in certain parts of the body. And when blood flows, initially it is pumped from the ventricle and it enters really large arteries, which is the aorta. Eventually, it has to enter smaller compressed arterioles. So when blood enters these smaller blood vessels, it applies some force on the blood vessel. And we can feel the force that it applies on the blood vessel in certain regions of the body. And that's what you measure when you're measuring the blood pressure of a person. So the blood pressure of a normal person is about 120 over 80, right? 120 systolic and 80 diastolic blood pressure, right? So that's the normal blood pressure. And then we have perfusion that we talked about. Perfusion is basically the amount of flow of blood through the tissues measured in ml per minute per gram, because we are looking at how much blood is flowing in a given mass of tissue at any given minute. All right, so the next thing over here is resistance. Resistance. Specifically, peripheral resistance. Peripheral resistance is a resistance of the arteries to the flow of blood. We just talked about how when blood flows, they first begin at a large artery, which is the aorta, and as they pass through the body, they get compressed into smaller blood vessels, smaller mid-sized arteries and arterioles, right? So as they have to pass through really constricted areas, there is a resistance towards blood flow, and that is called peripheral resistance. So in simple terms, the opposition to the flow of blood, wherein the blood vessels are resisting the flow of blood through them, is called resistance. Okay, now how would resistance affect blood flow? So let's quickly just look at this opening right over here. This is a big blood vessel and this is a small blood vessel, and I'm going to talk about the diameter and blood flow first and how the diameter affects the resistance. Okay, an opening or a bigger dilation is when the blood vessels open up, and when the blood vessels reduce in diameter, you call it constriction. Okay, so when you open up a blood vessel, you have a lot of blood easily being able to pass through the blood vessel. Okay, so there's more opening. So in the opening, blood can flow easily because it's a larger lumen. Okay, and then if you look at the smaller opening, you have a lot of blood trying to pass through, but the opening is very small, right? So if you reduce the opening, you have a lot of resistance, but you have very decreased blood flow because the opening is limited, right? For example, when you're trying to pour water with the bucket, you can pour a lot of water without a problem, right? But when you are trying to maybe pump water with a pipe which has a very small opening, you won't be able to pour a lot of water all at once. Okay, so when you maybe hold a water hose at the tip, you have increased resistance because you can feel the pressure of water on your fingertip, right? So think of it that way. So vasoconstriction increases resistance and decreases flow. Vasodilation decreases resistance and eases flow or increases flow. So the other factors that affect resistance is blood viscosity. Obviously, if the blood is really thick, the heart needs to work harder to pump that thick blood through the body, right? So people who have really thick blood, like in case of polycythemia vera, where they have really high number of blood cells, their heart works too hard to pump blood through the body. Okay, just take for example, it's easier to make water flow than to make a really thick potato soup flow through a pipe, right? And then the other factor that affects resistance in blood is the length of the blood vessel. The longer the blood vessel, the higher the resistance, okay? Because if the blood vessels are long, the heart needs to work extra hard to pump the blood through the body, okay? So when people are really tall, they don't live a very long life because their heart wears out sooner. So because of because of their height, the heart works a lot harder to pump blood to different parts of the body. So next thing you're looking at is hemodynamics. That is the dynamics of the flow of blood. And why on earth is this important? This is especially important in ICU patients because hemodynamic monitoring tells the healthcare provider what's the problem. Does a patient need blood? Is the lung getting enough oxygen? Is the heart pumping enough blood? Are the organs, especially the heart and the brain, getting enough oxygen? Okay, so hemodynamics helps us calculate or understand the flow of blood per minute. Okay, so here F stands for blood flow. F stands for blood flow. And we can measure hemodynamics with so many different invasive and non-invasive techniques. Now, if the patient is not super critical, well, still in the ICU, but they're not just about to just die and they don't have an organ failure, they're in the ICU and just being monitored, they can simply be hooked up to an ECG monitor to check the heart and see if the heart is working all right. Okay, now depending on the condition of the patient, they might use other techniques like checking the kidney function and maybe using a pulse oximeter to check the concentration of oxygen in the saturation of gases in the blood, or they can also use something like pulmonary artery catheterization. Okay, if you want to look this up, pulmonary artery catheterization. This is where they actually insert a catheter that goes right to the pulmonary artery and it directly measures hemodynamics. There are so many different reasons for us to measure hemodynamic, because if the hemodynamics is improper, if the blood isn't, if the heart isn't pumping blood, if the lungs isn't getting enough oxygen, if the tissues aren't getting enough oxygen, eventually the patient can have an organ failure, because if the hemodynamics are unstable, it can cause a mismatch between the oxygen demand and the oxygen delivery in the body. Everything comes to oxygen delivery, okay, in the end. So that's why it's important to monitor hemodynamics. Now, hemodynamics is most influenced by pressure and resistance, okay? And pressure and resistance are most affected by blood vessel radius or diameter. So basically, the diameter or the opening of the blood vessel will tell us the flow of blood, okay? And let's quickly revise this before we move ahead. You have a small hole, okay? Then you have a bigger blood vessel, okay? And the diameter or radius of the blood vessel eventually determines the resistance, okay? Okay, so how is resistance affected by radius? So you have a lot of blood trying to flow through the small vessel, so it'll have a higher resistance. And then you have the same amount of blood flowing through a larger opening, so it will be less resistant, right? So now you can say that when you increase the radius, you decrease the resistance in the blood vessel. So if you decrease the resistance, you increase the blood flow, okay? Or simply, we can call it as flow, okay? So resistance resistance and flow are inversely proportional to each other. Radius and resistance are also inversely proportional to each other. Okay, and this is the same thing that we talked about right over here. Okay, you're increasing the radius, you increase the radius, and then you decrease the resistance of flow. Okay, of course, when you increase the radius, more blood can pass through, so you increase the blood flow. And that's pretty much what this formula over here talks about. Okay, flow of blood is equal to difference in the pressure divided by resistance. So flow of blood is equal to delta P, which is the difference in pressure divided by resistance. So if you just look at the formula and if you've taken a little bit of math, you can tell that the flow is inversely proportional to the resistance. You decrease the resistance and you increase the flow. You increase the resistance and then flow decreases. They are opposite to each other. Okay? Okay, and the other factor that affects hemodynamics is pressure. Okay, pressure. So delta P, delta is the difference. Delta P is the difference in pressure. Okay, think of it this way. When you have, let's see, that's a dam, and then you have water pouring out of the top of the dam, you can see with how much force and pressure the water falls out, right? But now in a stream, there's not much pressure because there's not much difference in the pressure gradient on top, on the bottom, compared like you had in the dam, right? So the larger the difference in pressure, the larger the flow would be. Okay, so flow is directly proportional to the difference in pressure. So you can write that flow is directly proportional to the difference in pressure, but the flow is inversely proportional to resistance. Systolic and diastolic pressure. Now, where is this pressure coming from? Our arteries are under a lot of pressure because when the ventricles push blood through aorta, it causes them to expand because of their elastic nature. They contain a lot of elastic fiber, and in some regions of the body, these arteries are closer to the surface of the skin, and that's when we are able to feel a pulse. Okay, you don't feel a pulse everywhere in the body. There are only certain regions like the carotid artery, femoral artery, and then the ulnar radial artery. You can feel a pulse. Now, the systolic pressure refers to the maximum pressure when during the period of contraction, and diastolic pressure refers to the lowest pressure during the period of diastole or relaxation. So systole refers to contraction and diastole refers to relaxation. Okay, so let's first look at what's happening in diastole. Now in diastole, the aortic valve closes and blood cannot flow back into the heart. Okay, and when this suddenly stops, there's a recoiling of the aortic valve and other elastic arteries. So there's enough pressure that you can actually feel the arteries recoiling. Okay, and that's what you feel when you measure the diastolic pulse. Okay, or the diastolic measurement of blood pressure. Okay. But keep in mind that there's still enough pressure so that the blood can flow into the smaller vessels. Okay, but the diastolic pressure is the measurement of the lowest level of pressure in the aortic arteries, or in the arteries of the body at this time. Okay, now systole, on the other hand, is due to ventricular contraction. And when the ventricle contracts, it forces the blood through the aorta and into the arteries so much under pressure that this pressure causes the arteries to expand suddenly. Okay, and this expansion is what you measure, and the pressure under the expansion is what you measure when you look for the systolic pressure. So systolic pressure is the maximum pressure during ventricular contraction, and diastolic pressure is the lowest pressure in the arteries before the next ventricular contraction. So it's basically the end of diastole when you have the lowest pressure, and that's what we call diastole. Pulse pressure is the difference between the systolic and diastolic pressure. So in this case, the systolic pressure is 120, which is the normal, and the diastolic pressure is 80. So the pulse pressure would be 120 minus 80, which is equal to 40. Right. And then what you need to consider is mean arterial pressure. We'll get to mean arterial pressure in a second, but let's see diastolic pressure first. Now, diastolic pressure is more relevant because the heart spends more time in diastole than systole. The heart spends 2/3 of its time in diastole because the filling of the left ventricle takes place during diastole, or the relaxation phase of cardiac cycle, right? So you need to give the ventricle enough time to fill up before the heart contracts again. And that's why the heart spends a longer time in diastole. If you reduce the time in diastole, then there's lesser time for filling, right? So this may actually affect the heart and the blood pressure and a lot of other things. Now look at the mean arterial blood pressure. The mean arterial blood pressure is calculated by this formula: diastolic pressure plus 1/3 of the pulse pressure. So the first thing you'll do is calculate the pulse pressure and use this formula to calculate the mean arterial pressure. Why is the mean arterial pressure important? That is because mean arterial pressure tells us how much perfusion is occurring in organs, meaning whether the organs and tissues of the body are getting enough nutrients that they need, okay? And that happens under pressure, right? So the mean arterial pressure is significant, especially in patients with sepsis, right? So when a person is in septic shock, it means, like septic shock, I should write that down. So when a person is in a septic shock, it means an infection is severe enough and you experience a very large drop in blood pressure and your respiratory system gets affected, your heart gets affected, the organ gets affected, and then it eventually causes death, okay? Sepsis itself is a severe infection which will eventually lead to the septic shock. And sepsis is when you have the functions of your organs like heart, brain, kidneys, eventually all of them are affected, and it leads to multiple organ failure if it's not addressed immediately. And what causes sepsis? Sepsis is a condition which is usually in response to an infection, a bacterial infection or something like that. And your body responds to the infection by secreting certain chemicals, especially cytokine. Okay, cytokines. So when your body releases a lot of cytokines, it not only affects the bacteria that is infecting your body, it also starts destroying the infected cells in your body. And if too many cells in your body are infected, the cytokines start destroying those infected cells, and eventually what you have is just a hole in your organs, and it leads to the organs shutting down. So the importance of mean arterial pressure is to keep an eye on tissue perfusion. If you don't have good tissue perfusion, it means that your blood pressure has been affected, and organs are shutting down because they aren't getting enough nutrients. If your mean arterial pressure is too high, it means your heart is working really hard, and it can lead to heart muscle enlargement because your heart is working extra hard, right? So if your mean arterial pressure is too low, that can be life-threatening because it means your organs are not getting the nutrients and nourishment they need for survival. And that's why we're looking at mean arterial pressure. And this picture over here shows the flow of blood from the large arteries, then they move on to capillaries, and then they move on to the small venules and veins, and then they enter large veins, and eventually everything meets the vena cava, and the superior and inferior vena cava empty the deoxygenated blood into the right atrium. Right, so you can see over here, this is the arterial pressure, and systolic pressure is 120 on an average in a healthy adult, and systolic is the maximum pressure during ventricular contraction, and the lowest pressure during during relaxation, right before the next ventricular contraction, is the diastolic pressure over here. Okay, and you can see how the pressure reduces as they move from the arteries, and the moment they get into the capillaries, there's a lot of the pressure has reduced to very little over here, but they still have enough pressure to keep going, keep moving through the capillaries, and then they enter the venules. They are almost close to 10 or 0 here in the veins. So the muscles in our body play a very important role in pumping blood through the veins back towards the heart, because they are under little to no pressure over here. Okay, and that's where the skeletal muscles are important. All right, so let's quickly look at one example of mean arterial pressure. I'm going to do the calculations over here. Let me erase what I have. Right, so pulse pressure is equal to systolic minus this diastolic. So pulse pressure, I'm just going to write PP is equal to systolic. Over here you have 120 minus 80, which is the diastolic pressure. So the pulse pressure is equal to 40 mmHg. And then we need to calculate the mean arterial pressure. The mean arterial pressure is the diastolic pressure, which is 80 plus a third of the pulse pressure, and here the pulse pressure is 40. This amounts to about 80 plus 13.3, which is approximately equal to 93.33. So the mean arterial pressure is at 93 approximately. And the mean arterial pressure is anything between 70 to 100 mmHg. So this is considered normal. It means that there's enough and consistent pressure in your arteries to allow tissue perfusion through the body. So we talked about pulse pressure. Pulse pressure is the difference between systolic and diastolic pressure. And mean arterial pressure especially is important when we are looking at patients with sepsis or a septic shock. This is the formula for calculating mean arterial pressure, and I expect you to know this. And the blood pressure changes with age, and especially with conditions. When somebody has stiffening of arteries, now arteriosclerosis means stiffening of artery. Sclerosis means to harden or stiffen, and arterio means arteries. Okay, so in patients with stiffened arteries, they have weakened elastic tissues of the artery walls, so the blood pressure changes. Okay, then you have arteriosclerosis. Artero means gruel or some sticky stuff, and sclerosis again means stiffening. So arteriosclerosis specifically talks about building of lipid deposits in the blood vessels, specifically the arteries. A lot of times they become plaques and they cause a change in blood pressure. High blood pressure is called hypertension, and anything above 120/80 is considered, well, higher than normal, but usually if it's over 140/90, it is considered hypertension. Okay, and in hypertension, your heart is actually working extra hard, right? Because it's pumping blood with a lot of force, and this can cause increased risk of a heart attack or a stroke, and it can be life-threatening in cases, and eventually they can weaken arteries, cause aneurysms. Aneurysm literally means the enlargement of an artery when the walls get weakened. Okay, and they also promote atherosclerosis or deposition of lipids in the arteries because the arteries have weakened. When the arteries get weakened, monocytes migrate into the arteries and they attract more lipid molecules into the arteries that lead to atherosclerosis. Hypotension, on the other hand, is chronic low blood pressure. Now, when the blood pressure is really low, it can cause poor perfusion into the brains and organs, and it can lead to multiple organ failure if all organs don't get enough blood, right? Because the blood pressure is too low. And this can be caused even by blood loss, dehydration, anemia as well. And in normal people, for some people, low blood pressure causes no problem at all. But in some people, when they have low blood pressure, it can cause dizziness or fainting. And it can be really life-threatening if the blood pressure is too low. And if the blood pressure is too low, that is lower than 60 diastolic pressure, it means the brain isn't getting enough blood. And when that happens, people can become comatose, right? So you can get lightheaded if the blood pressure drops, and eventually if there's no perfusion in the brain, your brain is not getting the nutrients it needs to remain alive. Now let's talk about venous return. Okay, venous return. Venous return is interesting because the pulse or pressure at the vena cava, the inferior vena cava, is almost close to 0 mm of mercury. So how does the blood return to the heart if there's literally little to no pressure pulling them or trying to push them forward? So there are three mechanisms by which blood returns to the heart. The first one is, and the major one, is the muscular pump. The muscular pump is basically the contraction of the muscles that keep the blood moving, right? Now, if you sit in a flight for 20 hours straight, you of course will feel like your leg is stiff and maybe you have swollen legs because the blood has pooled too long. So if you take long flights like me, when I go to India, I have to walk every so often just so I can keep my feet from swelling up, right? So muscular pump is one of the main pumps for pumping the venous blood to enhance venous return. And then you have the respiratory pump. When you breathe air, every time you breathe, when you breathe in and breathe out, you squeeze your abdominal veins and you move blood upward, right? And then we have venal constriction. Venal constriction, they also have elastic muscles and smooth muscles, elastic fibers and smooth muscles, which are under the control of the sympathetic nervous system, which allows the blood to move towards the heart, right? So they are pumped involuntarily and moved towards the heart. Okay, so this is a picture of the skeletal muscle pump, and these are the muscles in red, and these are the veins. Every time your muscle contracts, it's squeezing blood through the veins and they move up, right? Good thing about the veins, they have valves, so they prevent backflow. So when the muscles are relaxed, the blood isn't allowed to move backward because of these valves. The one that moves forward keeps going forward once it goes past this valve. So the skeletal muscle pumps are very important for venous return. The regulation of blood pressure requires coordination between the heart, the blood vessels, and the kidney. And blood pressure itself is regulated by three main factors: the cardiac output. Cardiac output is CO, and the cardiac output really is equal to stroke volume times the heart rate, right? We've learned that before. So the stroke volume and heart rate affect cardiac output. And then we have peripheral resistance. Now, peripheral resistance is the resistance in the arteries when blood is flowing through the arteries, okay? And then we have blood volume. Now, blood volume is determined obviously by any cardiac conditions, and it is also determined quite a bit by the kidney. Kidney filters fluids from the blood. So the amount of filtration and glomerular filtration determines the blood volume as well. Now, as we have studied before, the flow is directly proportional to delta P, and delta P is the difference in pressure, which is really a measure of the actual blood pressure, and the resistance. And resistance is affected by the radius of the blood vessel. Now, the cardiac output is also equal to delta P by radius. So flow is really about the same as cardiac output, if you see, right? So we talked about how flow and cardiac output are the same because they are both affected by the same factors, and they are both inversely proportional to resistance and directly proportional to pressure. And then we have blood pressure. Blood pressure itself, or delta P, is equal to cardiac output times the resistance. Okay, so PR is the same as R. Okay, so if you feel It's easier to remember R, just remember R. So these are some formulas that you need to remember. And you should know just basic math. For example, delta P is equal to CO times R, and R will be equal to delta P divided by cardiac output, and so on. Just simple basic math. Now, how can you raise the blood pressure? If you know these formulas, then you know how pressure and resistance affect flow and cardiac output. You can think about how can you raise blood pressure. To raise blood pressure, you either need to increase cardiac output or you need to increase resistance. Okay, so blood pressure, because it's directly proportional to the cardiac output and resistance, you increase blood pressure by increasing the cardiac output or increasing the resistance. Okay, so just think of a garden hose when you're watering the plants. Okay, when you hold the tip of the water hose, it increases a lot of pressure. There's a lot of resistance because you're constricting the water hose. The pressure increases, the resistance increases, but water also comes out with a lot more force. So you're actually increasing the output, right? So blood pressure is directly proportional to the cardiac output and the resistance. Okay, now when you increase the blood pressure, really you're affecting the heart rate as well. So when the blood pressure goes up, the heart is working really hard. So it increases the heart rate. And now we can say it increases stroke volume as well, because stroke volume is the amount of blood ejected from each ventricle during the contraction. Okay, so you can see how all of these things are directly related. So when you increase cardiac output, resistance, heart rate, or stroke volume, blood pressure gets increased as well. Okay, so you can see when you change one variable, it quickly changes every other variable. Okay, so there's no other way around it. You have to remember these formulas because you might need to know the calculations. We have already talked about cardiac output before, so this will be just a quick revision on cardiac output. Cardiac output is equal to stroke volume times the heart rate, and then the stroke volume itself is equal to E dV minus E SV. So the normal cardiac output is anywhere between 5 to 5.5 liters per minute, and it is determined largely by venous return. And venous return is really the amount of blood coming back to the heart, which in turn is a reflection of how much blood is being pumped out of the left ventricle, right? You can only return the amount you pump out, and that's why it is determined by venous return. And the other factors that affect cardiac output is the nerves and hormones in the body. And the parasympathetic nerve, cranial nerve 10, which is the vagus nerve has a parasympathetic effect, meaning it calms the heart, right? So if you disconnect the parasympathetic nerve, the cardiac output the heart rate will increase. And then stroke volume is controlled by venous return as well, or it is also controlled by preload. Preload is the amount the ventricle can stretch. Okay, now if you take the analogy of a balloon, so if you blow up a balloon, okay, it recoils a lot faster than a limp balloon, right? So the more the balloon can stretch, the more it can contract, and heart works the same way. Now when the amount the heart can stretch is called preload. So if preload is high, the contractility is high. Okay, so when the contractility is high, the afterload is also high. So afterload is basically the pressure that the heart must overcome to eject blood. And keep in mind, the aorta and the other blood vessels already have blood in them. So when the heart stretches too much, it holds a lot of blood, and then when it contracts, it ejects a lot of blood. And while it's ejecting blood, it is working against other pressures around the heart, right? So when preload increases, contractility increases, and afterload increases as well. Now, this chart just summarizes all the factors that affect cardiac output, and make sure you understand the basic terminologies before you look at this. When you exercise, of course, your skeletal muscles are working hard, you breathe really hard, and then your sympathetic nervous system is really active. So all these three factors are pumping a lot of blood back to the heart because it increases venous return, right? Because venous return is affected by the increase in these three factors. So when you increase the amount of blood returning to the heart increases EDV, meaning end diastolic volume. Now the end diastolic volume is the volume which the ventricles are filled right before contraction. So the heart stretches more to accommodate more blood because a lot of blood is being returned to the heart. Okay, and the heart stretches more, so the stroke volume increases, so it ejects a lot of blood out, right? Because it needs to continue pumping more blood and oxygen to the tissues and skeletal muscles that are really working hard while exercising. So thus the exercise is the initial stimulus, and everything is green. In green is the physiological response. And when you increase the stroke volume, the cardiac output increases. Now what happens when our blood pressure is low? When the blood pressure is low, the medulla oblongata activates the inhibits the parasympathetic activity, because parasympathetic activity promotes rest and digest response, so it calms the body. So you don't want that to be active when your blood pressure is low. So the medulla oblongata reduces parasympathetic activity, and at the same time it increases sympathetic activity by releasing hormones like epinephrine and norepinephrine. These epinephrine and norepinephrine increase the contractility of cardiac muscles, and they decrease end systolic volume, meaning the amount of blood left behind in the ventricles after ejection. Okay, that means the heart is pumping more blood out. That's why you have less left in the heart. Okay, and this causes the heart to beat more, right? Then you have less ESV because you have a high stroke volume. Now, if you don't understand EDV and ESV and stroke volume, you first need to know what they are to understand this flow chart. Okay, so in the end, the cardiac output gets increased or decreased depending on what the heart needs to do or what the body needs.